Good afternoon, and welcome to each and every one of you for being here with us today. Black Health Matters, Kappa Alpha Psi Fraternity Incorporated, and AARP welcome your participation. I am John B. Kane II, Regional Vice President, and I humbly represent AARP, which is a nonprofit, nonpartisan organization that empowers people to choose how they live as they age. So let me emphasize again, AARP's mission is to empower people to choose how they live as they age, but Alzheimer's and dementia take that privilege away from millions of Americans and people all around the world. With nearly 10 million new cases of dementia and Alzheimer's disease occurring each year and no cure, patients and family caregivers need safe and effective new treatments and relief from the physical, emotional, and financial stress of this devastating disease. Furthermore, I am reminded that a great deal has been written concerning COVID-19 pandemic and social isolation, with one area of focus being the knowledge that social isolation increases dementia risk by approximately 50% in older adults. So as we prepare to hear from our esteemed healthcare experts, I ask that individually and collectively, we each focus on building positive social circles that satisfy our respective needs, like spending more time with family, friends, neighbors, pets, or even volunteering with organizations like your AARP. Finally, another area that AARP stresses is the personal health and vitality, and according to the Centers for Disease Control, up to 40% of dementia cases may be prevented or delayed through instituting healthy behaviors. AARP has developed 6 pillars so people can incorporate lifestyle changes that may be helpful. 1, be social. 2, eat right. 3, manage your stress. 4, ongoing exercise. 5, get restorative sleep. And 6, engage your brain. Again, I'm John B. Kane II. AARP thanks you all for joining today. And I thank the healthcare experts, Dr. Shaun Smart and Ms. Eunice L. Sykes, as they next share information concerning the important issues related to Alzheimer's and dementia. Thank you.
Hi, I'm Eunice Sykes, and while I am not a healthcare expert, I am a loving, unpaid caregiver to my husband, now deceased, who had and was diagnosed with Alzheimer's disease. I was introduced to the Alzheimer's dementia space about 12 years ago when I was playing golf, and a lady that I was golfing with, who I'd never met before, asked me about memory loss. And she had just come through an Alzheimer's dementia journey, and she was saying that she wanted to share many of the stories, lessons that she had learned, and she was not a writer. So she wanted to know if I knew of someone who could work with her to write her story. Well, as fate would have it, God would have it, divine intervention would show up. I said to her, I'm a writer and I would be delighted to write your story. At that time, I knew very little about dementia or Alzheimer's. What I found out was that the dementia category, the whole category of dementia, has various types of dementias underneath it. Alzheimer's, of course, is the largest category, but there are others like frontotemporal disease and alcohol-induced disease. My focus, however, was on Alzheimer's. I wrote her book, and then as I was marketing the book, I was having some issues of my own at home with my husband, with some erratic behavior. and not recognizing that behavior just yet. We were in pre-diagnosis, early stage. I ministered the book that I wrote for her called Mashed Potatoes in My Salad was ministering to me. I used it as a resource. And what I have found out is in my search for other resources, there are very few books out there that dealt with Alzheimer's from a loving caregiver perspective. You had the perspective of the medical community, you had the perspective of the researchers, you had the perspectives of paid caregivers, you have the perspective of neurologists. There was never much, very little, in the way of giving a perspective to a loving unpaid caregiver who was in the trenches 24/7. So someone said, if there's a book that you want to read and you can't find it, then you need to write it yourself. And that's what I did. I wrote this book called Boosting Joy in the Grips of My Alzheimer's Caregiver Journey as a guide, a resource, encouragement, education, myth buster to people who are starting that journey, still in the journey, and know very little about the disease. Everything is happening very fast and they're not aware of what's going to be next. There's always a what's next. And so that is the reason why this book was written. And that's the reason why I'm here, to share with those caregivers, those loving unpaid caregivers, that there is a resource, that there is tactics that can help you boost your joy. You just have to find those tactics. You have to come in with the right mindset. You have to look at your loved one as a part of your life that you're going to live better. So it's all about living your best life better with the circumstances that you have.
Hello, everyone. My name is Shaun Smart. I am a neurologist, assistant professor of neurology at UT McGovern Medical School in Houston. Specifically, I am an epileptologist and epilepsy specialist. Spent over 10 years as working in the community as well as working in academics. Right now, I primarily work in the hospital in the Texas Medical Center at McGovern Med School, as well as teaching residents and medical students. My fascination and my interest in Alzheimer's comes from primarily a hospital-based setting, but as well as a community-based setting. You know, what we see a lot is, especially with the African-American community, we know that African-Americans are twice as likely to develop dementia. The type of dementia in African-American is also a little bit different. We're more likely to develop vascular dementia. And that gets into healthy lifestyle, as Mr. Kane mentioned before. So my fascination and the reason why I'm here is to try to give some educational points to help not only recognize dementia, but also try to prevent it from the beginning. So when you're talking about dementia, you have to realize there's many different categories, right? Dementia is a memory abnormalities. So you can have memory issues, but the memory issues with dementia are usually affecting long-term memory. We do see memory issues sometimes that are short-term memory issues. Those short-term memory issues can affect things like forgetting where your keys are, forgetting what you're supposed to do. Now, sometimes these get confused with a dementia early on, and these may be signs later on that you may be dealing with what we call mild cognitive impairment. So you have to recognize those things early on. And those may also be signs of what we call a pseudo-dementia that you see with patients with depression. So the reason why we want to talk about this is because the earlier we can recognize some of these signs, the earlier we can do things to intervene. The easiest things that we know that can be done, especially with the vascular causes of dementia, is exercise, diet improvement, right? While there is a genetic component to dementia, there is a huge environmental component. We know that the lack of sleep, we know that smoking, air pollution, all of this can affect somebody's risk of developing dementia. Depression also can affect somebody's risk of developing dementia. So recognizing these mild symptoms early on and intervening, one can help slow, if not eliminate the progression, especially if it's a vascular dementia, but also help plan for the cure. Because while Alzheimer's is the most common type of dementia, it is by far not the only type of dementia, right? Because we do have, we have Alzheimer's dementias, which is primarily memory. We have what we call frontotemporal dementia, which is primarily behavioral changes. And vascular dementia can be a mix of many different types and can be more debilitating, because with vascular dementia, you can have memory impairment on top of motor or sensory abnormalities due to repeated strokes. So when we have this discussion on dementia, I think what we have to do is not just focus on one disease process, because we know the reason why African Americans are at a higher risk of developing dementia is not just genetics. It is because of also the environmental factors that are prevalent in our communities, right? So, we know if you have a first-degree relative with dementia, you're at a 40-something% risk of developing dementia yourself. But even if you have a spouse with dementia and no genetic connections, you have an 18% higher risk of developing dementia yourself. And that's usually because of the environmental factors. So the goal that I hope that we can talk about here is, how can we prevent these things? How can we change the lifestyle in terms of being healthier, working on, smoking, stopping as much as we can, exercising, getting frequent checkups to deal with high blood pressure, because those things decrease your risk. Diagnosing diabetes early. I just had a patient in the hospital who, 40-year-old gentleman, didn't know he had diabetes, presented in severe diabetic ketoacidosis, which is basically blood sugar so high that his body is shutting down. But these are the things where we need routine checkup, routine care, especially as we get older. And then also, once we recognize that these symptoms are developing, going to the appropriate centers and the appropriate level of care to get evaluated. For example, once you have a family member and you're concerned that they may have signs of dementia, well, those are signs. That's an indication where you need to go to your a neurologist. While you may love your primary care doctor or your family care doctor, at that point, once you're concerned about your family member having dementia, it is very important to see a neurologist early on. And once you see a neurologist, to ask for what we call a full neuropsychological evaluation, which is an extensive test. It's not just an in-hospital test, but it's an extensive test where us as neurologists work with PhDs to actually evaluate if this is dementia, what type of dementia it is, and how do we plan the care. So my goal here, and the reason why I'm here, is to hopefully help and provide information to prevent some of these dementias, recognizing some of these dementias, and getting the proper treatment. The one other type of dementia that I want to talk about, a little bit different than the ARP population, what I'm seeing more and more is nutritional dementias. What I'm seeing now, we have a lot more individuals having surgeries, gastric bypass surgeries specifically. And what we're seeing is when you have those surgeries to alter your digestion, well, you're required to take nutrition to supplement it. What's happening is in our community, what I'm seeing in the hospital, people are forgetting to take those supplements and they're presenting with a nutritional dementia. So these are all new things that are becoming more and more prevalent. And I'm hoping that by this discussion, we can identify these things and we can help prevent them as much as possible.
Let me add that my husband was an electrical engineer, for those of you that are engineers out there. And he was a healthy specimen. When he was in his 70s, doctors were always amazed at how physically fit he was. My husband was a golfer all of his life. He was an exerciser. He was a walker. He was doing all of that. And he presented to me a situation whereby we were having a conversation and all of a sudden he lost his words. He came out of the room continuing the conversation, and all I heard was bub, 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 bub. So that to me was my flash that there was something wrong. Of course, he had been doing some things like not recognizing that his keys were keys, not knowing that a tomato was on the counter. All of those things were adding up to this language difficulty, which propelled us to his general practitioner, who sent us to a cognitive neurologist, who sent us to a neurologist. And they did all of that testing. And my husband was diagnosed initially with mild cognitive impairment. But of course, within a year, my husband was in full-blown Alzheimer's disease. And so, all of the things that we have presented here have various impacts to those of us that are worried about our loved ones. This man completed the entire Alzheimer's journey. He went from a healthy, vibrant, excited, lovable, energetic 70-year-old to an 81-year-old who knew nothing about anything.
Wow. And unfortunately, that's a typical story that we see, because there is a significant genetic component to Alzheimer's independent of environment. And as I said before, first degree relatives of somebody with dementia has a higher risk of developing dementia. There are many different types of dementias. Alzheimer's is the most prominent, but as I said, we have frontotemporal dementia, we have Lewy body dementia, we have mad cow disease, we have Wernicke's dementia, nutritional dementias, vascular dementias. Each one of these present a little bit differently and have a little bit different time course. We have dementias that are associated with Parkinson's disease, right? We also have pseudodementias that's associated with depressions and psychiatric disorders. We have medication dementias that may be a side effect of medications, those things. So there are many different types of dementias. There's many different symptoms that may present at different times. And as Mr. Sykes pointed out, it's very important to see a neurologist when there is concern early on, so that they can work with you. Because to go from mild cognitive impairment to dementia is around approximately 2 years. Not all patients with the mild cognitive delay will develop dementias, but I think it's a little bit less than 50%.
It's a 50% chance, yeah.
Okay. We'll go on to develop it. And the nutrients, somebody asked, what's the nutrients that we have to work? Vitamin B, vitamin B6, vitamin B12. We see a lot of alcoholics or heavy drinkers or people who have gastric surgeries, they don't get enough vitamins. And those can be a serious impairment. But we forget, there's a reason we call them essential vitamins, right? There are things that our brain and our nervous system needs. And unfortunately, the way a lot of our diets are set up, we don't always get those vitamins. And especially if people end up having surgeries, your body don't get, you shorten the ability of your body to get those vitamins out of your foods.
Yeah, dementia, Alzheimer's and dementia are dementia, again, is the question up here, is the broad umbrella with all of the dementia types underneath it, Alzheimer's being one of them. It's probably the most common one. But I would say it takes about 3 years of observing and having conversation with your loved one before you can figure out that something may not be quite right. And you will probably have some sort of a trigger that says to you, yeah, something's not quite right. And yeah, we probably need to go to the doctor. It is not normal. Aging is normal. Dementia is not normal. How can you best support your loved one that has dementia? You need to go where they are. It took me several years to figure out that I can't argue with my husband about whether the weather is rainy or whether it's cloudy. I have to say whatever he says it is, I have to say, yes, babe, you're right. It's cloudy outside and the sun is bright in the sky. That's how you avoid a lot of contention and frustration. You need to be where your husband is in his dementia journey. And what I learned early on was that it was better to have peace than to be right.
So that's a
Absolutely
beautiful
better to have peace than to
That's
be
a
right.
beautiful point. Dementia patients do what we call confabulate, meaning they create a reality in their minds.
Yes.
And the thing is, they are, especially Alzheimer's, are what we call happily demented at times, because whatever they won't recognize that they have memory impairment. It's one of the things I tell my residents. Most of the times with severe Alzheimer's patients, they will never complain about memory impairment. Their families will, because what Alzheimer's patients do when they don't remember things, they do what we call confabulate, and they create their own reality. Now, as a family member, sometimes you're tempted to challenge that reality, and that could create a lot of conflict. So what we do tell family members is to try to figure out how to work with that reality, to then use that to get the patients to do the things you need them to do, and to function. We're not completely sure why Alzheimer's occurred. We do know that there's some protein buildup in the brains at times. It is not part of normal aging. Some patients, and we see it run in families where the protein leads to buildup. And unfortunately, nothing that has been approved stopped the progression of Alzheimer's. We do
There's
not have
absolutely no cure. You're right. There was absolutely no cure for the disease.
No, especially even with the new FDA approval, even with Aricept. I'm not a huge fan of Aricept in general because I see all the side effects without any significant improvement in memory. A lot of it is what Mrs. Sykes brilliantly just laid out, is working with the patient as a family member and doing what you can to help the patient function while trying to also take care of yourself. Just yesterday, actually, I had a wife break down in tears to me because I had to tell her that you may, even though you don't want to, you may need to put your husband in a facility because it is taking a toll on you. And dementia, what I tell my families is dementia, dealing with a dementia family member is a marathon, not a sprint. Meaning if the family member gets burnt out, there is nobody left to take care of the patient. So you have to first, and this, it's like on the airplane, you have to first take care of yourself so that you can continue to take care of the family member. Because if you get burnt out or you get sick, that person is left with nothing. And that's the hardest thing. As I said, when I send this to the wife, and you could see the love in her husband, she just started crying. But I had to tell you, without you, he has no one. And that's one of the hardest things sometimes I have to get across to family members.
Self-care is not being selfish. One of the boosting joy moments for me during my journey with my husband, Don, was that he recognized that this was going to be overwhelming for me as well as for him. And he recognized while he still had memory that we were going to need some help. I was his exclusive caregiver. And my husband said to me early on, probably between pre-diagnosis and stage 1, he said, I want to go to a facility where I can get 24/7 care. I want the caregivers to be African-American males, and I want you to make sure that I am taken care of. Don played a very integral part in how we were going to get through this disease. My husband was purposeful and he was intent on us getting through this and my not falling apart. And believe me, I had health issues early on before I learned that it's better to have peace than to be right. I had some health issues that came up. I had to have some surgery. So having an option like long-term care, and it can be an option, and it doesn't have to be extremely expensive. And there are health resources out there to make that happen. Having that option was a godsend for me. I also would caution caregivers to also be sure that you connect with support groups. The Alzheimer's Association has various support groups. They have support groups for spouses and they have support groups for family members. I rode 3 hours round trip once a month to go to a support group because I knew that I needed to be around people who were feeling what I was feeling, who was going through what I was going through. And that was a godsend for me. All of that information is in the book. One other final joy booster that I would share around long-term care is that I found out just by having conversation that you can negotiate, caregivers can negotiate the price that they pay for long-term care. That's a tidbit that you don't want to forget, those of you that are caregivers out there. If they tell you they're going to charge you $7 grand a month to keep your loved one, doesn't have to be that way. You need to push back. Be blessed.
That would be something I would add as well. There's a difference between nursing homes and assisted living. I mean,
Absolutely.
I'm a little bit biased because my mom has ran an assisted living most of my life. And I think assisted living is a much more intimate and a lot of times a lot more caring situation because assisted living facilities a lot of time would have less patients and a better nurse to patient ratio. But it's also about finding a good one where you feel comfortable with the care and in an environment that is helpful. Sometimes nursing homes where you have a huge patient population and these huge facilities are not necessarily the best thing for dealing with patients who are demented.
That's correct. That's correct. And you need to start early. Start early before you are going to need that service so that you have time to, do due diligence on all of your options. And nursing homes was not an option early on. I found that out from, people that I talked to. Your husband's not ready for a nursing home. He's ready for a long-term facility that has an activities director that can plan activities, that can keep them engaged. Because when Alzheimer's patients are engaged, they become engaging for a long time, And you will see glimpses of your loved one. That's part of the boosting joy piece. You will be surprised. My husband was a dancer. He was a fabulous dancer. I didn't realize that until he got around all that music. Music is very integral to patients.
This is why even with my patients, I recommend assisted living facilities because it's easier to negotiate those things. It's easier, especially early on. You can go with your loved one to help there. And also a lot of assisted living facilities have daycare programs where you can try it out early on, where you can bring the patients there for daycare. You can drop them off. You can see how they interact with staff. You can see how they do it before you determine that that's going to be where they're going to, if that's somewhere where they want to stay. So I'm a bigger fan of smaller, more intimate settings for my dementia patients rather than the bigger facilities. Of course, as things become more severe and they need more advanced caring, sometimes a nursing home is the appropriate setting, but sometimes early on, I find that assisted living facilities are a lot better.
Actually, my husband Don never went to a nursing home. He was taken care of in a assisted living facility that had tiered services.
There you go.
The other point that I want to make is that there are adult daycare centers that specialize in dementia and or Alzheimer's. That was my first foray into something outside of the home for my husband. And it was I drop him off at 7 o'clock in the morning. I pick him up at 5 o'clock in the evening. But I soon found out that, by the time I got my bill for that kind of time there, I could go ahead and look at long-term care.
And I'll answer one last question before, because I think this is important. Dementia occurs in younger patients. Alzheimer's disease can also occur in younger patients, especially in families with genetic predisposition.
Yes.
A lot of the dementia that I see in younger patients are either nutritional, drugs related, are genetic. The one that I'm seeing, and the reason I brought this up, and I'll say it again, in younger patients, especially younger women, is nutritional, and a lot of it is due to these gastric bypass surgeries. If you know somebody who's had these surgeries, please make sure that they continue to always take their daily multivitamins, because it's hard to get the proper nutrition out of the food because of the surgeries if you're not taking your daily multivitamins.
Someone is asking for the name of the book again. It's called Boosting Joy in the Grips of My Alzheimer's Caregiver Journey. And I have a website, www.eunicelsykes.com. It's my name. I also have a Facebook page. You can pull it up by my name as well. And I'm sure that the organizers of this event can pass that information and or will pass that information along.
Something else I think is important. Somebody asked, and this is something I see in the hospital all the time. How do you get an elderly person in a facility against their will? Very good question. What you need to do is one of two things. One, if you haven't gotten the person to get power of attorney of health or get them signed over to have you be their healthcare decision maker, what then needs to happen is you need to take the patient to a neurologist, have the patient undergo neuropsychological evaluation, and deem able to make their own medical decision. Once a patient has been evaluated by a neurologist and deemed not to have capacity, that is sometimes a venue for then the family member, which is next the spouse, and then after that it would be the eldest children, to make that decision. One other thing I like to tell family members to look for early on in dementia patients before we wrap up, because this is very important, because this is what all physicians will ask you. When did they stop being able to pay their own bills? What we see a lot of times is a lot of people are very independent. Once they start having mild or signs of dementia, they start having trouble managing their own finances. They start having trouble doing the basic function of just what they've done all their lives. And that's what we use as the start sometimes of the Alzheimer's or the dementia, because we notice at that point, there is a significant change and they're able to function. Like we'll see family members, people who love to cook. All of a sudden, somebody else is cooking for them. You know, somebody who's always used to manage the finances, and they're like, well, honey, you could take the finances now. And those are the signs that are the telltale signs of these changes, where the person may not completely be aware that they're not what they used to be, but they're aware that something is working as well.
Yeah, my husband was clearly aware that something was going on. He actually gave me books once we got that diagnosis of mild cognitive impairment and a 50% chance that it was going to lead into Alzheimer's. He had books from Johns Hopkins. He had white papers from the Mayo Clinic. He had several Alzheimer's related books. He said, I think you need to read these and you need to get ready to start paying the bills. And it was within months, 6 or 8 months after that, that we went to the doctor, because my support group said they're going to resist giving up driving. So we went to the doctors, and the doctor suggested that Don stop driving, and he gave me the keys.
And one thing before we wrap up, somebody asked a very good question. When you don't have financial means, how do you get help?
Yeah.
All right. I'm going to say this, and I'm going to say it with a caveat. Each family is different. So there are government, Medicare, Medicaid, Social Security can be helpful. Sometimes what happens though is you may have had savings that limit your ability to get access to these programs. I have honestly told patients you may need to move the finances into one person's name, restructure them, talk to your family, and then figure out how to make those things. I can't tell you how to do that, but there are ways to.
Your lawyer can.
Finances.
Your attorney can.
Yeah, your attorney can help you do that. Adjust your finances such that your family member can qualify. Because when I see some of these patients early on, what even the spouse who's sick would say, I don't want them to use up our savings to take care of me. And I recommend they see an accountant or an attorney to figure out, okay, how can we adjust our finances such that we can qualify for these government programs? Because there's ways to do it.
I have 2 points to make regarding that. The first point is that if your loved one is a veteran, there's a little known, little used, hard to get benefit. It's called aid and attendance. But if you persist, there's a ton of paperwork. If you persist and your husband or loved one is eligible. That's a big help in trying to finance long-term care. The other caveat that I would issue is that the earlier, the better for all of your decisions in this dementia world, because then your I want to keep saying spouse because it was my husband, then your loved one can assist in making those decisions. Thank you. There are other questions.
Yeah, I'm addressing some because I think we're running out of time.
Okay. Okay.
So what I was saying is that the progression for dementia is different for each type of dementia. So that's why it's important to see a neurologist. If you're fortunate to be in a city like Houston or another big city, there are people who all they do is dementia. We have a couple people here at our UT in Houston that all they do is dementia. So seeing those patients, those physicians is amazing, because they will figure out what type of dementia you have, lay out a plan in terms of how they may progress, and give you all the care, the advice and planning the care that are necessary. And I see coming up again is, what do you do if you know, if somebody's unwilling to go to a facility? See a physician, have the person evaluated to see if they have capacity to make their own decisions. If they deem not able to make their own decisions, then the spouse or the person with the medical power of attorney becomes the decision maker, and the patient can be put in a facility from that regard. Once again, this is why it's important, even now, early on, families need to sit down and talk about and plan, not just for dementia, but for all these medical issues beforehand, so that, you know, you as your spouse know, okay, do you want to be on a machine or ventilators, or do you want a feeding tube or not? You know, how do you want decisions to be made? You know, I've seen situations where the spouse struggles with making decisions, and because they knew this up front, they assigned an older child, an adult child, to be the decision maker, because they understood that the mother or the father would not have been able to withdraw care, which is what the other person wanted. So these are decisions as families. Yes, they start with spouses, but a lot of times it's important to involve the elder kids, because the kids are next in line. So it usually goes from spouse to adult children in terms of decision maker, if a decision maker has not been chosen in an advanced directive. So
Yeah,
this is a family decision.
you really need to be clear about who's in charge as early as you can, because dementia has no timeline. You just know it's going to go down. But it's like a roller coaster. They'll have lucid moments in the midst of all of this upheaval. And when you get those lucid moments, those are absolutely moments that boost your joy. Sit there and rest and meditate in that, because you need that power, that strength that encourages to get to the what's next episode. There's always going to be a what's next episode.
And in terms of specific multivitamins, there isn't any. You know, the first thing you can is, what I tell my patients sometimes is, you know, try whichever ones. You just make sure they have vitamin B, vitamin B12, those type of things. And, you know, if you can, even if you hate salad like I do, at least once a week, try to eat something with green leafy vegetables like spinach, and, you know, try it very slow. I try to, you know, I'll go and I love fish. I'll have, like, you know, salmon on top of some spinach, but trying salad once a week, you know, those type of things of making slow changes to your diet is very important, because as I age, I'm realizing I have to make those changes, right?
Yeah.
I have to find different types of nutritional salads that I can't eat, because I can't eat the same thing as I used to when I was in my 20s.
Well, thank you guys so much for this wonderful presentation. It's so much information. I feel like we could talk all day about it. We have so much more wonderful information that's going on after. we love all the information. You answered so many questions in the Q&A. There's so many more popping up. I would say please stay tuned for the next summit. Thank you for your participation. And there's another session literally going on right now. So thank you, Dr. Smart and Ms. Sykes.
Will you put this information somewhere? It's because people are asking for it. Or maybe
Sure.
just my website.
Yep.
Sykes.com.
Absolutely. We can also, this video is available for whoever registered. The summer will be up for 90 days. So they could go back and get all the information and rewatch it as well. Okay.
Great.
Thank you so much. Bye-bye.
Thank you so much. God bless.
Ms. Sykes, like I said, you are a healthcare expert. And Dr. Smart, you better get to Atlanta before we shut it down. We're getting full.